Obamacare was the focus of withering hearings this week over the website fiasco, which put the White House on the defensive and emboldened Republican critics.
The central issue here, as we've talked about before, is not can we build a great website, it's can we make sure that the American people who deserve affordable, quality health insurance are able to buy it. And that's why the president's so frustrated by the website, more frustrated than anyone else.
This is about more than just a website, and it will take more than a 1-800-ROSE GARDEN infomercial from the president to fix this. The failure of Obamacare launch is just the tip of the iceberg, and unless we act, Americans will be stuck on board this Titanic. This is why Republicans are going to keep fighting to protect consumers from the consequences of the health care law.
We also learned something pretty stunning. The Obama administration knew all along that as many as 93 million Americans may be unable to keep their health plans under Obamacare, notwithstanding the president's repeated chronic promises that everybody who liked their plan and doctor could keep them, period. Remember that? Well, here now for a fair and balanced take on all of this, Ellen Ratner, the bureau chief of Talk Radio News Service, Fox News contributor. Matt Schlapp joins us, former White House political director under President George W. Bush. Matt, you know, I have right here, this is the Federal Register. It is dated June 17th, 2010. In it, the administration, that is the Treasury, Labor, Health, they all project, we'll put it up on the screen, 93 million Americans, they project are going to lose their health plan. There's the breakdown. This includes both employer plans and individual policies that would be lost. Yet, the president repeatedly stood before the American people. He promised no one, absolutely no one, would ever lose their plan, period. I mean, Matt, is that a presidential deception on an unprecedented scale?
Well, I'll tell you what, if you're one of those millions of Americans that are going to lose their health insurance plan, Greg, I think you think it is. And I think there's a reason why the president's approval ratings across polling agencies, but I woke up and looked at the Gallup numbers today, he's at 41%, which is nearly his lowest level. Only 25% of Americans think Obamacare is actually going to make health care better. I mean, this thing is in a very dangerous position for Democrats going into next year's election. But more important than the politics around this is just about a website and health insurance. What happens when this gets to actual health care delivery? Right. That's what Americans are really worried about.
I mean, Ellen, the president now seems to admit the deception. He said on Wednesday in that speech in Boston, he said terminations, quote, were a central premise of the Affordable Care Act from the beginning. My goodness. I mean, that's pretty audacious by the president, isn't it, Ellen? I mean, there's no wonder that Americans are recoiling at this.
I am one of those people that was paying so much for my individual health care plan that by not continuing that plan and being able to buy it on the open market, once that disastrous site starts to work, I will most likely get a much better plan. Now,
but
I'm such a lefty that I would
have... You haven't been on the site, you haven't shopped, you don't know, right?
Oh, yes, I have been on the site.
Well, and what have you found?
Unfortunately, I could not stay on the site. That is a big problem. It's a disaster. There's no question about that. The issue is once the site gets fixed and people can sign up, is it going to work? And I am going to say right here on Fox News Channel that I think it's going to work just fine. Really? All right. We're going to remember that.
Owen, isolate that soundbite from Ellen. We're going to be using that. But look, Matt, also on Wednesday, the president kind of shrugged it all off. He told people, hey, you know, just accept your termination notice. And then he said, shop around. Just shop around. That's all you have to do. I mean, look, I got to tell you, we've interviewed countless people who have been forced to shop around. Unlike Ellen,
that's right.
Their results have been absolutely awful. I was watching yesterday Neil Cavuto talking with a woman on air. She said she absolutely loved her plan for many, many years. It was affordable. And she got canceled because of Obamacare, and now her monthly premiums have gone from $363 to $713, and her deductible has doubled. Does that really sort of put a lie to the president's other promise that your cost's going to go down?
Yeah, of course. I mean, let's face it. We all know what an unfunded government mandate does to a business or an individual. It makes their costs go up. There's no, subsidy that goes along with these unfunded mandates. You have to have health insurance that has these particular qualifications, and that'll mean prices will go up. It also means, let me tell you what's happening in Virginia. I was meeting with some small business people the other day, Greg. They actually got online, which is a huge achievement, and they actually were able to shop. Do you know how many plans were available for them to scrutinize? One plan. So this idea that you're going to have a whole, 5 or 6 options in your health care is wrong. What's happening is that the whole underpinning of the program, the idea that more people would join the health care insurance pool and that costs would come down, seems to be untrue. And I'm glad that Ellen would have been the 7th person on the first day, but there's not enough people that are jumping in.
Ellen, the president blamed in that speech on Wednesday, blamed insurance companies for canceling. Well, they have to cancel under Obamacare. It's illegal to sell policies without the EHBs, those enhanced health benefits. So, I mean, why should people be forced to pay for things they don't want or need?
Let's put it this way. Listen, I'm to the left of even the Democrats on this. I think that there should have been a way to buy into Medicare, which we know works, a single-payer plan, not involve the insurance companies. But I think actually the insurance companies have a lobby here, and they want this Obamacare in some way. They may not want to take the risk, but they do want it because they're going to make some money with
Ellen,
it.
why should a man, myself included, be forced to buy maternity care? I don't need prenatal
why should
care.
you? If you're a good driver, why should you be forced to buy car insurance? Or house insurance to get a mortgage. It's just the way we assign risk in this country.
Trust me, absent a modern medical miracle, I'm not going to need maternity care delivering a baby.
Miracles happen.
That would be a real news story. All right. Matt Schlapp, Ellen Ratner, good to see you both.
Thank you.